Colon cancer rates are on the rise, especially among people under the age of 50. It's an alarming trend, prompting experts to change the age for colonoscopy screenings. Tonight, experts from CNOS will answer your questions about the procedure. Find out why it's so necessary, how to prepare, and what you can expect. Colonoscopy Conversation and Care, the plan, prep, and procedure.
Good evening, everyone. Thanks for joining us tonight for what we hope will be a very enlightening half hour answering your questions about colonoscopies.
KTIV has partnered with CNOS to try and bust some of the myths about this very important step in your healthcare journey.
In studio with us tonight, 3 doctors who specialize in gastroenterology. They will be here for the entire half hour to answer your questions about colonoscopies.
And you can email your questions right now to connect@ktiv.com.
But how did we get here? As we mentioned, KTIV has partnered with CNOS in this project. The CEO of CNOS, Nolan Lubarsky, joined me in this project as we both got our very first colonoscopies. Lubarsky's grandmother had colon cancer, and that family history pushed him to get a colonoscopy just a few weeks after he turned 45. And at 51, I was overdue. So on October 25th, we both arrived at Mercy One Medical Center in Sioux City. The actual colonoscopy itself only took about 20 minutes, and we were both discharged within about 3 hours after we first arrived at the hospital. Now, Lubarsky got a clean bill of health. No polyps, no need for another colonoscopy for 10 years. But when Dr. Jeff Michalak inspected my colon for any irregularities, he found one. Actually, he found two polyps that he documented and then removed. Those polyps were sent off to the lab for analysis, and 5 days later, the results came back, and it was time to meet again with Dr. Michalak to find out what those tests showed.
Good morning, Nolan.
A very good morning.
Everything went really well with your procedure?
For CNOS CEO Nolan Lubarsky, Dr. Alexander Sarkeesian didn't find any polyps during Nolan's colonoscopy.
You get a 10-year pass for your next colonoscopy.
Great.
That's good news, too. Remember, Nolan's grandmother survived colon cancer.
Well, first and foremost, with a family history, that you just want to hear that things are okay. And so I was relieved to hear that.
As soon as he turned 45, Nolan wanted to get his first colonoscopy. 2 years ago, a task force recommended that adults with an average risk for colon cancer get screened at age 45, not 50, which was the standard.
There were a lot of patients that would come in for their screening colonoscopy at age 50, and they would be found to have a cancer at that time.
It's the reason at age 51, I wanted to get my first colonoscopy.
The results from your colonoscopy went well.
But Dr. Jeff Michalak found 2 polyps during the 20-minute exam of my colon.
The 2 polyps we took out, both benign. However, one of them has that precursor component to turning into cancer down the road. That's what we call an adenoma. And so over time, those can turn into cancer. And so we take those out now so that we don't have to worry about that in the future.
I'm glad I did it. I'm relieved, too. He told me what it was he took out and that one of them was precancerous. Had I not come in to get a colonoscopy, had I waited another couple of years, who knows how it would have turned out.
Which is why it's so important, no matter what your risk, to get a colonoscopy.
I would say just go. Like, have the confidence to go do it. Check it off your list. You know, make sure that it's something that you do to take care of yourself.
Matt Breen, KTIV.
So let's get to your questions. They will be answered tonight by Dr. Sarah Bly, who is board certified in internal medicine and gastroenterology. Also joining us tonight is Dr. Jeff Michalak, and he's board certified in gastroenterology as well as internal medicine. And finally tonight, Dr. Alexander Sarkeesian, and he's board certified in gastroenterology, focusing on hepatology and obesity disorders. Thanks for joining us. So 2 years ago, a task force recommended adults with an average risk for colon cancer get screened at age 45. Before that, the screening age for adults with an average risk was just 50 years old. So Dr. Bly, why was the age recommendation changed?
It was changed because we're just noticing a trend towards earlier and early onset of colon cancer. And as was pointed out earlier, these cancers start out as these small little polyps that can be removed. So the idea being if we start screening people earlier, then we can find those early cancers actually before they're cancer when they're at the polyp stage and eliminate them.
All right, thank you, Dr. Bly.
So knowing how important it is to get screened as early as 45 years old, let's talk about the process. What is the process for scheduling a colonoscopy? Do you have to have a referral from your doctor? Can you call CNOS or another provider and schedule it yourself, Dr. Michalak?
Actually, all of those are correct. Most of the time, the usual process, the primary care doctor makes referral over, sends over the records. We review the records. We call the patient. We go over the process, the location, date, time. We send in the prep, and then they get scheduled for the colonoscopy. Now, patients can't take it upon themselves to either call the provider, like CNOS, any of us physicians, and start looking into that, or they can call their primary care physician and take it upon themselves to get it scheduled and referred.
And you know, one of the big questions, we have all heard horror stories about the prep prior to a colonoscopy. In fact, Bernadette sent an email and said she's tried the pills instead of liquid prep, but they still made her feel pretty awful. So Dr. Sarkisian, are there any different type of preps out there?
So there's several different preps that are FDA approved for pre-colonoscopy preparation, and all that a prep is, it's a solution that you drink that cleans out all the contents of the digestive tract. Visualization of the colon is actually very important, one of the most important things during a colonoscopy, so we can see polyps that are located there. But you know, for patients who have difficulty tolerating the prep, the pill form is an option sometimes, and then if that's too much still, what I would suggest is that patients slow down the rate of consuming the prep, and a lot of times that can help with the side effects of nausea. It's just a large volume of liquid to consume, and most people aren't used to that, so just slowing it down can help a lot with that.
Okay, so one more question about the prep. We did get an email, and it comes from a viewer who has had stomach bypass surgery. And so they're worried about, as you mentioned, the amount of prep they actually have to drink. So what would be your recommendation?
Gastric bypass, the size of the stomach is incredibly small compared to a normal size of stomach. So in those patients, we do often recommend they start a little earlier for their prep, maybe even double the time that it would take for them to drink all the volume of the prep. And then just kind of listen to their body's cues. If they're feeling nauseated, just slow down and make sure they give themselves time to get it down so they're not vomiting or experiencing really terrible discomfort.
Yeah, and so of course we all want to know, Matt, Nolan, your experiences. We've been kind of getting some enlightenment into what y'all had to go through. So let's talk more about your prep. How was it, Matt?
Well, I know just doing research, it's not as much as it used to be, Nolan. You know this. It used to be a gallon of solution, right? We had two 32-ounce basically sports bottles to drink. The first bottle over an hour, the second bottle about 4 hours later over the course of an hour. So that wasn't terrible. It was a lemon lime flavor. What'd you think about the flavor?
Yeah, mine was more like lemonade, and Dr. Sarkisian told me in advance, and I think this was on one of the segments, that to try with a straw because that goes down a little bit smoother, and I think that helped quite a bit, actually. Yeah,
the straw thing, I wish I would have known that. The other thing, pro tip here, make sure it's very, very cold. I read that online too, so make sure you put it in the fridge for at least an hour before you drink it. And really the other thing, the only hiccup I had, it was a little thicker than a sports drink. What did you think about the consistency?
Yeah, the consistency was a little bit thicker. I thought so as well, but you got to shake it up and shake it up good, and then get yourself as close to the bathroom as you possibly can.
Yes, yeah. He's not wrong about that. So here's the next question that a lot of people do fret over is the cost. A lot of people are concerned about the cost of the colonoscopy. So will insurance pay for a colonoscopy? Dr. Bly, where does the cost come down in the procedure?
This is a procedure that is covered by insurances. There can be some slight differences. Some insurances will cover screening and preventative things at full cost. Others, there may be a small copay, so you can always call your plan and find out if there will be any cost to you. But when the reason is for screening, it's generally very well covered.
All right, still ahead, more of your questions to come. To include, a lot of patients are asking this question: does a colonoscopy hurt? Well, the answer is next. But first, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. The American Cancer Society says the estimated number of colorectal cancers in the U.S. just this year include 106,000 cases of colon cancer and 46,000 cases of rectal cancer. Stay with us. We'll be right back.
And welcome back to our colonoscopy conversation and care. The next question for our doctors: is a colonoscopy painful? Does someone have to have anesthesia for a colonoscopy? And I'll leave that open to any of you because you all have a similar answer on this, but you can actually have it both ways, correct, Dr. Michalak?
Correct, yeah. You do not have to have anesthesia to have a colonoscopy done, and in and of itself, it's not painful. However, the majority of people don't want to know it's occurring. they don't want to risk the pain. Can there be some discomfort, as a few folks have had a colonoscopy without sedation? However, most people prefer, and that is probably the right move. The nice thing is when you go to sleep, you wake up and the colonoscopy is over, you don't even know it was done. If polyps removed, like in your case, Matt,
yep.
We don't feel that on the same on the inside, so you don't have any discomfort. So all in all, it's really a smooth procedure and does not cause any discomfort with the propofol.
And Dr. Bly, do you want to weigh in?
Sure. I mean, I would definitely reiterate, I've done it on patients both ways, with anesthesia, without anesthesia. People are more relaxed, obviously, under anesthesia, which can help our job to be a little bit easier, but it's definitely possible without it if people have a strong reason to consider no anesthesia.
All right, thank you, Dr. Bly. And of course, we want to ask Matt and Nolan, did you guys feel anything?
Well, we were asleep. We have to reiterate, we were both asleep for the procedure. We both had propofol, which is a different drug that they use now than they may have used 10 or 15 years ago. So it was a nice 20-minute nap, wouldn't you agree?
I was going to say that was the best nap of my life, to be honest with you. And the one thing that I guess I had a little bit of concern about was, you know, is it going to be painful or anything afterwards? And it really wasn't at all. It was very smooth. Yeah,
and Dr. Michalak removed 2 polyps from my colon. Obviously, I was asleep. I didn't feel it. And even after I woke up, you couldn't tell. So I have to imagine, doctors, I'll let you weigh in on this. The nerves have to be different in the colon than they would be, say, on the surface of your skin.
That is correct. We're thankful that the anatomy is a little different on the inside as it is on the outside.
Very good.
All right, well, as we continue our coverage tonight, Janie emailed us saying when she had her last colonoscopy, she remembers waking up during the actual procedure. So are there complications from a colonoscopy? And Dr. Sarkisian, I'm going to leave this question with you.
Yeah, so, you know, I'm thinking that may have been a colonoscopy years ago that was done under a different type of sedation where some patients were awake, or conscious sedation, we call it, where they may be able to answer questions, follow commands, and they may remember parts of it. Usually with propofol, even if a patient does wake up for a few seconds during the middle of the procedure, an anesthesiologist or anesthetist will usually give a little additional medication and they go right back off to sleep and don't remember any part of it. Complications of the procedure are possible, but you know, in terms of major complications, it's extremely rare. Much less than 1 in 1,000 is pretty much what, you know, in my experiences, I've seen the rates of complication. It could include things like bleeding from the areas where polyps are removed. Usually it's pretty minor, and some patients may see a little bit of blood in the stool with their next bowel movement, and that usually kind of goes away on its own. It's pretty rare and uncommon that someone has a colonoscopy with a polyp removed and has any major bleeding or needs to return to the hospital for, you know, transfusions or repeat colonoscopy. But, you know, 1 in 1,000 type of thing can happen like that, and that's something that we take care of if it happens. If we need to go back and treat any areas that are bleeding, we can do that with the endoscope.
So no need to be afraid.
Exactly.
All right, thank you, doctor.
Now, we know that one of the things you can find during a colonoscopy is a polyp. Obviously, Dr. Michalak found 2 in my colon. 1 was precancerous. So, Dr. Bly, for those at home who aren't as educated as you are, describe what a polyp is.
Sure. So a polyp is just a small growth on the skin surface of the colon, almost like a little wart. And they happen for a variety of reasons, genetics being one of the biggest factors, again, alluding back to why Nolan was so spot on about having his colonoscopy with the family history. But yeah, they just start as a couple millimeters in size, very tiny, and then over the years they grow larger and larger. And as they grow, that's when when the cells grow and divide, when they can transform into a cancer.
All right, Dr. Bly, thank you for that. And so I know a lot of you submitted this question. What are some signs, symptoms of colon cancer risk? In other words, Dr. Michalak, what should someone be looking for?
So I'll start out that a lot of the signs and symptoms that you can see with colon cancer are very subtle at first. And this is the reason why it's imperative to get a colonoscopy done, because sometimes once these signs and symptoms hit you, it's usually too late. You can have the cancer and even be metastatic at that point, which is where the cancer has gone outside of where it started. So that's why we look at the guidelines and we say start doing it when it's appropriate for you based off family history, risk factor, age, and that sort of thing. But some signs that we can look for in folks that haven't been up to date with getting their colonoscopy when they should: change in bowel habits, whether it's constipation, looser stools, if they see any blood in the stool. Occasionally people can have abdominal discomfort with this as well, weight loss. And then routine laboratory studies can show people to be anemic, where they're slowly losing microscopic blood from a big polyp or a cancer. And that's another indication to see one of a gastrology team to further look into for endoscopic evaluation.
So if they have some of these symptoms or they're seeing some of these signs, is it just like once in maybe a week, or what is kind of the time frame if they continue to see it?
Usually it's subtle and it will slowly continue over time. And so I usually tell folks that if you have any change at all, even if it's just a few times, to address with your primary care physician, address with your gastroenterologist, because if it's something bad, it will continue to progress.
All right, thank you, Dr. McCullough.
Still ahead, we're going to address those at-home colonoscopy kits. Do they work? How reliable are the results? First, though, the American Cancer Society says the rate of people being diagnosed with colon or rectal cancer every year has actually dropped overall since the mid-'80s, and the reason might surprise you. It's because more people are getting screened and changing their lifestyle-related risk factors. We'll be right back.
Welcome back to the colonoscopy conversation. By the way, we are streaming live right now on KTIV.com as well as our KTIV Facebook page. So if you have a question you want answered, go ahead and weigh in. Well, you know what? There are so many different types of colon cancer. So how many types are there and how are they treatable? Dr. Sarkisian, I'm going to let you take this question. Are there different types?
Yeah, absolutely. There are different types of cancers that could be found in the colon. The most commonly found type we do encounter is adenocarcinoma, but there could also be neuroendocrine tumors or lymphomas of the intestinal tract, and actually a large variety of things that could be found there. I think what's most important when it comes to treatment and how they're treated is depending on the stage that they're found, and kind of like as we've talked about before, the earlier the cancers are found, the more treatable they typically are. Sometimes we resect a polyp and there ends up being a small area of cancer on it and it's completely resected and that's it. A patient may not need additional type of surgery. Other times we may find that there's invasion of the cancer into the blood vessels or lymphatic circulation of the polyp stalk or at the base of the polyp, and then patients may require chemotherapy, surgery with dissection or removal of some of the surrounding lymph nodes where cancer could have spread, and even times radiation. So there's a lot of different treatments, and it all depends on the type of cancer, the stage of the cancer, and if it has spread outside the colon wall to other surrounding organs or even farther away to other organs like the liver, lungs, or other areas like that. So there's a variety.
Yeah, thank you, Dr. Sarkisian. Next question is, and you've probably all seen the commercials for Cologuard, the at-home colon screening kit. How accurate is Cologuard or some of the non-invasive tests like a CT colonoscopy, Dr. Bly?
The answer to that is a little bit broad. Every different type of colon cancer screening has essentially a set of pluses and minuses, pros and cons. Certainly the Cologuard, you don't have to take off time for work, and it's privacy of your own home. You don't have to do bowel prep. So those are some notable things. It does have a little bit higher chance of being negative and being wrong when you may have a large polyp or a cancer as compared to the colonoscopy. So that would be one of the negatives of that one. But there are situations where it's appropriate. So usually when it comes to the different types of screening, I would say if you have any question or concern over what to do, just talk to your doctor and they can help you weigh through the options and see what's right for you.
All right, thank you, Dr. Bly. Dr. Michalak, what can someone do to help prevent colon cancer?
Well, as we've been discussing and going through this whole time, the best approach is to get your colonoscopy done when it's your time to get it done. To catch these polyps like Dr. Bly was talking about, catch them early, remove them at an early stage before they turn into cancer, and then you're on the appropriate protocol and guidelines for when you're due for your next colonoscopy. Dr. Bly had already alluded to previously too about different lifestyle changes that we can make, certain dietary changes, certain foods we can avoid, tobacco, that sort of thing. So a healthy lifestyle, talk to your primary care doctor about when it's time to get a colonoscopy and what dietary changes is right for you.
All right, thank you.
And very quickly, Dr. Sarkisian, I want to ask this. We've talked about Cologuard, it's non-invasive. We talked about CT colonoscopy, non-invasive. How important is it, though, to get that colonoscopy in terms of prevention?
Yeah, so colonoscopy is actually an incredible screening test because not only are we able to detect lesions, we can prevent those lesions or those polyps from growing into cancer. So, I think it's really the most important part, in my opinion, is that you get it done and you get those polyps removed early. You almost just prevent them from ever causing a problem before they have a chance to. So that's a very important step.
That's exactly true. All the other tests are diagnostic exams to say is there cancer or not. The colonoscopy is the only one that can take a step to prevent a future cancer.
So if you have a family history, get it. If you're 45, get it, bottom line.
Yep. Absolutely.
Thanks, doctors.
And still ahead, we wrap up our special and offer some additional resources if you still have questions about colonoscopies. But first, from 2011 to 2019, the incidence of colon and rectal cancer has dropped about 1% each year. That's according to the American Cancer Society. But this downward trend is mostly in older adults and people younger than 50. Rates have been increasing by 1 to 2% a year since the mid-1990s. We'll be right back.
We're going to squeeze in one more question for our doctors, and Dr. Michalak, this came from one of our viewers. How far back in your family history should you go when it comes to a history of colon cancer?
That's a good question. So usually a first-degree relative specifically is the main factor we look at. However, if you have 2 or more second-degree relatives, that also puts you at an increased risk and should be screened sooner, usually 10 years earlier than the time that patient was diagnosed. So if it's diagnosed at 40, start at the age of 30 for that family member.
All right, Dr. Michalak, thank you for that. And we have reached the end of our half-hour special dedicated to answering your questions about colonoscopies.
Of course, we want to thank all 3 doctors for taking part, helping to educate all of us on the importance of getting a colonoscopy.
And we want to thank CNOS for partnering with KTIV to make this special possible.
And a big thank you to CNOS CEO Nolan Lubarsky for putting himself through this with me, taking this journey to get our colonoscopies on camera. Thanks for sharing. Thanks.
And thank you for watching. Good night.